the admission rate is higher in DD population, and we were also interested in knowing the cost per person, DD versus general. And the next slide shows you that. It's interesting that although the admission rate is higher in DD population, the cost per person is higher for general Medicaid population than DD population. In general Medicaid population, it was 18,694 per person, and in DD population, it's 17,419 per person. So this slide shows you the admission rate by gender. The admission rate per 1,000 was slightly higher in females compared to males, 16.9 per 1,000 person in females and 15.8 per 1,000 in males. So we were also interested in knowing the admission rate by admission rate for ICF and waiver people. Admission rate is higher for ICF people compared to waiver people. You can see that for ICF it was 14.3 per 1,000, and for waiver it's 11.7 per 1,000. Although the admission rate for ICF individuals is higher, you can see that the cost per person is lower for ICF people compared to waiver people. So since the cost per person was higher for waiver people, we were interested in looking at the length of stay, average length of stay for these two populations. I mean, the average length of stay in hospital for these populations. And you can see that there's not much difference between the average number of days in hospital for ICF and waiver population. For ICF, it was 6.6 days, and for waiver, it was 6.8 days. So this slide shows you the admission rate of septicemia or sepsis per 1,000 DD population by age group. You can see that the rate is higher for 0 to 2 age group and for 65 plus age group compared to other age groups. And this makes sense because for the age group 0 to 2, the immune system is not completely developed, so they are not able to fight infections as efficiently as higher age group people. Also for 65 plus, your immune system starts getting weaker and weaker as age progresses. So it should be that their immune system is weaker to fight infections. So the rates are higher here. This slide shows you the clinical conditions that were present among DD individuals who were hospitalized for septicemia or sepsis in calendar year 2015. You can see that the first two bars represent the clinical condition pneumonia. The first one is for bacterial, and the second one is for those pneumonia that could not be classified anywhere else. If you add those together, like 48% of individuals who were hospitalized for septicemia also had pneumonia. And the other clinical conditions present among those hospitalized people were diabetes, cerebral palsy, you can see neurological discord, infections like urinary tract infections, skin infections, pressure ulcers, and some injuries. So this slide shows you the rates of septicemia or sepsis admissions per 1,000 DD population by county, and the counties with darker colors are those with higher rates, and those with lighter colors have lower rates of admissions. There are some counties like you can see on the southeast that have higher rates, and there are some on the top. The conclusion that we can make from this analysis is that admission rate of septicemia or sepsis is higher in DD population compared to the general population. As mentioned earlier, you can see that in DD population it was 16.3 per 1,000, In general Ohio Medicaid population, it was 2 per 1,000. And according to CDC's National Center for Health Statistics, the admission rate for septicemia or sepsis in 2008 was 3.8. So the admission rate in our population is higher compared to those two rates. Also, we saw that the admission rate was higher for age group 0 to 2 and 65 plus. Special care should be taken to prevent sepsis in this population. Although rate of admission is higher in ICF population, cost per person is higher for waiver population. So this indicates that indicates that our control efforts should be focused in both waiver and ICF population.